Dear audience, very welcome to this lecture on prudent use of antibiotics in mastitis. I am Ylva Persson. I have been a veterinarian for more than 20 years. I started my career as a district veterinary officer, working with large animals in the countryside, perhaps a little bit like your Upasila veterinarians. I have a PhD in reproduction and my thesis was on fertility disorders in beef bulls. Since my dissertation, I have been affiliated to the National Veterinary Institute of Sweden, SVA, where I am appointed as an associate state veterinarian in ruminant diseases, focusing mainly on mastitis and antibiotic use. In Sweden, I have been doing a lot of research on udder health in many different species, like dairy goats, beef cows, sheep, and of course also dairy cows. I have also been involved in many projects outside Sweden, mainly in low-income countries, like Kenya, where I have been involved in a project on mastitis caused by Streptococcus agalactiae, but also other health projects in Uganda, Rwanda, and also in Bangladesh, which I will talk a little bit more about later in this presentation. For the moment, I am leading a project on udder health and the milk value chain in water buffaloes in Bangladesh. The National Veterinary Institute is a Swedish national authority that strives for good animal and human health, a good environment and a sustainable food production. And our vision is healthy animals, safe humans. SVA works in 4 different areas. Diagnostics, where we are Sweden's leading veterinary medicine laboratory. Research, where we do mainly applied research and develop new methods, and also surveillance, where we monitor both endemic and episodic diseases. And, like I do today, communication, where we share our knowledge both within Sweden and in many other countries. So, with this brief introduction, I would like to move on to the subject of today. Why is it important to combat antimicrobial resistance? Well, society focuses mainly on human health and the possibilities to treat people also in the future. But as a veterinarian, I think it is equally important to be able to treat also our animals. Not only for the animal itself, but also to ensure food security and safety. Healthy livestock with prudent use of antibiotics and low levels of antimicrobial resistant bacteria will help us to fulfill some of the sustainable development goals, like reduce poverty and hunger, but also good health and well-being among humans, and responsible consumption and production. Emergence and spread of antimicrobial resistance are mainly driven by 2 factors: overuse of antibiotics and underuse of biosecurity and hygiene. And we will talk about both these aspects today. The so-called Swedish model is based on animal welfare. We strongly believe that profitable livestock rearing with healthy and productive animals is not possible if you don't take good care of the animals and treat them with respect. Sweden also has a long history of control and eradication of many infectious diseases. And today, Sweden is free from tuberculosis, brucellosis, foot and mouth disease, IBR, BVDV, and many more. Sweden was also the first country in the world to ban antibiotics as growth promoters already in 1986. And since then, we have continuously been working for low and prudent use of antibiotics. But neither of this had been possible without the Swedish way of always discuss and cooperate in order to meet consensus between all different stakeholders, from farmers up to governmental officials. Do not create systems where antibiotics is a must. The best way to keep a low and prudent use of antibiotics is to keep the animals healthy, since healthy animals do not need antibiotics. And this will also be the main take-home message for today. Healthy cows do not need antibiotics. To achieve this, a composite strategy is needed. You can't do just one thing, but one good thing to start with is to stop the unnecessary use of antibiotics. For instance, antibiotics as growth promoters, but also routine prophylaxis like blanket dry cow therapy. And then to reduce the need of antibiotics by keeping the animals healthy and to stop the spread of diseases. Still, sick animals will always need treatment, and then antibiotic use needs to be optimal. Finally, it is important to monitor antibiotic use and antimicrobial resistance for benchmarking, goal setting and follow-up. The rest of the presentation will focus mainly on number 2, 3 and 4, and I will give you examples of them from the dairy sector and udder health. Before we start, I just want to go through some definitions of mastitis that can be useful for the understanding. Mastitis can be categorized according to symptoms, where clinical mastitis is with visible symptoms and subclinical mastitis is without visible symptoms. And clinical mastitis can be further divided into grade 1 or mild clinical mastitis with only milk changes, or grade 2 and moderate clinical mastitis with symptoms from both milk and udder, and grade 3 or severe clinical mastitis where we have milk and udder symptoms accompanied by general symptoms like fever, inappetence or recumbence. Mastitis can also be categorized according to duration, where acute mastitis is with a sudden onset and chronic is with a longer duration. So, to minimize the need of antibiotics and to prevent spread of pathogens, we need to keep our cows healthy. And for good udder health, we basically need to do two things. We need to find the healthy cows, and we need to have knowledge on the risk factors for mastitis in each herd. And once we know that, we need to protect the healthy cows from being infected with other pathogens by minimizing the risk factors. The most widely used method to detect mastitis is by measuring the inflammatory white blood cells, the so-called somatic cells in milk, either indirectly with California Mastitis Test or CMT, or directly by using a somatic cell counter. CMT is a rapid, user-friendly and cheap cow side test. And I suggest you test udder quarter and cows with CMT prior to any decision making. For instance, after calving for decision on grouping and milking order, before mating to decide if the cow is worthwhile to have pregnant again, and before drying off in order to make decisions on selective dry cow therapy. I also recommend you test the bulk milk once a month to get an idea of the somatic cell count for your herd. This bulk milk somatic cell count is a rough indicator of the herd udder health, and by measuring it over time you can follow trends in the herd, but also benchmark with other herds. Bulk milk somatic cell count can also be used as a milk quality tool, which can be used for penalty or premium payments from the dairy plant. Bacteriology is an additional diagnostic tool, and knowledge of the bacterial panorama in the herd is important for optimal risk factor interventions, and on cow and quarter level it is important for decision making regarding antibiotic treatment, but also culling. If you want to improve the udder health, you need to start by setting realistic targets for average herd somatic cell counts and clinical mastitis rates. You need to set goals. Then you need to have a clean, dry and comfortable environment for the cow, optimal milking procedures, maintain milking equipment, keep good records, manage clinical mastitis cases, and have optimal dry cow management routines, and also good biosecurity programs, and monitor udder health status regularly. And finally, to periodically review your mastitis control program. And you can find a more detailed description on this widely used 10-point plan at NMC's website. NMC is an American organization working with udder health on a global arena. And at the end of the presentation, I have provided you with a link to NMC and the 10-point plan. But now I will give you two practical examples, one on good biosecurity routines and one on optimal milking routines. And optimal milking routines are among the most important factors to focus on in a dairy herd. And you should always consider a milking order where you milk the healthy cows first and the cows with mastitis last. You should always clean the hands before milking and also dry them, and preferably also wear disposable gloves. Then you need to wash the udder, but you also need to dry the udder. And then examine the foremilk to facilitate early detection of clinical mastitis, but also for a proper milk letdown. Then the actual milking will take place, and after that I advocate you to do post-teat dipping to disinfect the teats after milking. It's also good advice to keep the cows standing at least 30 minutes after milking before closure of the teat canal. And remember to perform the same routine every day. And here is an example on biosecurity routines, in this case routines for farm visits. And this is how Swedish veterinarians are dressed when they visit dairy farmers. They have a rubber coat which is changed between farms and also possible to wash in 60 Celsius degrees. They also wear Wellington boots that are carefully washed between farms. And both male and female vets cover their hair when entering the farm, since hair can carry lots of pathogens. Disposable gloves are used depending on task, but always during milk sampling. Hands are washed before and after each farm visit, and hands are also disinfected in alcohol. If a higher biosecurity is needed, for instance during a coronavirus outbreak, which is quite common in Sweden, extra disinfectant is used for cleaning of boots and equipment. For some years, I was leading a project in Bangladesh funded by the Swedish government, aiming for a development of another health program. The funded project has now ended, but a program called Udder Health Bangladesh is currently running under the leadership of my colleague Dr. Mijanur Rahman and his team at Sivasu. They can provide udder health advice services, lab facilities and trainings. And we have also developed an informative web page, a very popular Facebook group, and an udder health manual that might be available today as hard copy. And don't hesitate to contact the team for help with any udder health related matter. So, to summarize this first part of today's presentation on how to minimize need and avoid spread. Healthy animals will lead to lower use of antibiotics, better animal welfare, easier labor for the farmers since it's more time-consuming to take care of sick than healthy animals, more milk of better quality and also higher growth rates of the offspring, higher consumer trust including safe food, and all this together will lead to more profitable dairy farming. And remember, healthy animals will lead to happy farmers. So, healthy cows do not need antibiotics, but sick cows must be treated. And as a support for treatment decisions, we need guidelines. These are the ones available in Sweden. One joint Nordic guideline for mastitis treatment in dairy cows and one Swedish for more species and diseases. And both of them are available in English for free download, and the web pages are provided at the end of this presentation. For acute clinical mastitis, narrow-spectrum penicillin is advocated in most cases. So, for all the gram-positives like staphs and streps that are sensitive to penicillin, penicillin for 3 to 5 days is recommended. Staphs resistant to penicillin, like beta-lactamase producing Staph aureus, should not be treated with antibiotics but only supportive therapy. And E. coli and other coliform gram-negative pathogens should not be treated with antibiotics either, but only supportive therapy. And the overarching recommendation is only lactation treatment for acute clinical mastitis. Chronic clinical mastitis and subclinical mastitis are better treated during the dry period. Several studies from many different countries have shown that the efficacy of antibiotic treatment of coliform mastitis is very limited. In this study, we could show equal treatment effects with quinolones and placebo, why our conclusion was that acute clinical mastitis caused by E. coli does not need to be treated with antibiotics. So just to summarize where antibiotics are not needed. For most gram-negatives, for resistant Staph aureus, since they are not treatable regardless of antibiotics used. In cases of Mycoplasma bovis, and chronic mastitis and subclinical mastitis during lactation, and also for mastitis caused by fungi. For mastitis cases not treated with antibiotics, supportive therapy becomes even more important. But also when antibiotics are used, supportive treatment and care may be added as additional treatment. The most important supportive drug is probably the NSAIDs, and they are anti-inflammatory, analgesic and antipyretic drugs. They should always be given in severe cases. Studies have also shown that fertility can be improved if NSAIDs are given in early lactation, also to moderate cases of mastitis. Extra milkings and oxytocin have been debated recently. It might have a beneficial effect for gram-negatives, but some studies suggest it can be detrimental for mastitis caused by streptococci. Extra care, including a clean and comfortable lying area, should always be provided. Extra fluids should be given if the cow is dehydrated, and biosecurity precautions should be taken to decrease the risk of spread of contagious other pathogens. Consider isolation of the sick cow. As mentioned previously, chronic clinical and subclinical mastitis are better treated during the dry period. And always consider selective dry cow therapy. Blanket dry cow therapy means you will treat also the healthy cows, which is an unnecessary treatment with antibiotics. Selective dry cow therapy means you will treat only cows with mastitis diagnosed with CMT and bacteriology. Healthy cows should not be treated, and neither should very chronic cows with a continuously high somatic cell count, since prognosis for recovery is poor. And again, resistant staffs will not respond to any antibiotic treatment, while dry cow treatment for those cases are not recommended. Different antibiotics will have different properties, making them more or less suitable for mastitis treatment. A good mastitis antibiotic must be able to maintain therapeutic concentrations within the udder and be compatible with milk. Penicillin, cefgenome, and quinolones are all examples of antibiotics with good mastitis treatment properties. However, we need to consider the recommendations from the World Health Organization of not using the most critically important antibiotics intended for humans. They should be used very restrictive in animals. There are also some antibiotics that are less suitable for mastitis treatment, since they will partly lose their effectiveness in milk. And finally, for some antibiotics, it will be difficult to keep and maintain therapeutic concentrations in the udder. To facilitate decision-making, the Udder Health Bangladesh team have developed a treatment decision tree for clinical mastitis. I will not go into details, but my colleague, Dr. Mishanur Rahman, again, has promised to bring hard copies for you today, and hopefully there will be someone there to distribute them to you. As promised earlier, I have included some useful information. If you click on the links when opening the slideshow in your computer, you will be able to reach the links directly. And I particularly encourage you to do the MOOC course on antibiotic use, developed by the Swedish University of Agricultural Sciences. And MOOC means Massive Open Online Course, which is open for everyone. Just to conclude, prudent use of antibiotics is to treat only when necessary and with as narrow spectrum as possible, and to avoid the most critically important antibiotics according to the World Health Organization. And they are the fluoroquinolones, the third and fourth generation of cephalosporins, and the macrolides. And finally, the most important, healthy cows do not need antibiotics. Feel free to contact me if you have any questions. Thank you very much for listening.